in listen-only mode.
Hello, everyone, and welcome to our second nationwide sponsored Pet Poison Helpline Continuing Education event of the year. Thanks to all of those who are returning, and welcome to everyone who's new. My name is Dr. Anna Brutlog. I'm the host of today's webinar. I'm the Associate Director and a Senior Clinical Toxicologist here at Pet Poison Helpline. And again, I'm delighted to have everyone with us. Thank you so much for attending. Today's topic is certainly a hot one. I can't tell you how many questions we get about decontamination. It's something that, we do fairly frequently, but there's so much misinformation out there and so many questions and opinions. So the aim of our lecture today is to really drill down to what the essentials of decontamination are, provide you with the science that's out there, some of it which is quite new and maybe surprising to you, and offer you a very nice summed up package deal about how to appropriately decontaminate your patients. Specifically, we're really talking focus today on cats and dogs. So Dr. Renee Schmid, one of our veterinarians, will be presenting today, but before we get going, let me just announce a couple of quick reminders. And I want to say, give a big thank you to Nationwide, who has been a very generous long-term sponsor of our continuing education endeavors, and we so appreciate that. So before we get started, if you do not have a copy of the handouts and you want one, you can actually download or print, whatever, the handouts from the handout screen in your dashboard, so in the GoToWebinar dashboard. I also put some instructions about this in the chat box, so you can see that. If you don't see them in GoToWebinar, you can go to our website, petpoisonhelpline.com, go to the For Vets tab, and click on Webinars. So today's webinar is being recorded, as are all of our webinars. So you will get RACE approval for attending today's webinar. I'll talk about CE certificates in a second, but we will record this. So if you have colleagues who couldn't attend today, or you think this was a particularly helpful webinar and want to recommend it to others, they will be able to access our website and watch the recorded version and also earn CE approval for that. So how do you think, what do you think about that? Pretty slick, huh? We have actually quite a growing library of free RACE-approved webinars on our website. So if you ever need CE, it's a fantastic place to check out. So now, CE certificates, always the big question. We will be emailing CE certificates to everyone who logged in to today's webinar. So you'll get those by the end of the week for sure. Probably you'll have them in 48 hours. If you don't get it by the end of the week, email us. And you'll have our email in the last slide of the webinar. It's info@petpoisonhelpline.com. Now here's what's important. If you are watching in a group, or you're watching but you are not the person who logged in and you would like to receive CE credit, we need to hear from you within 24 hours. So you have a very strict deadline. Send us the names, the full names, and email addresses for everyone who is watching today's webinar, and we will get a CE certificate sent to those people. So today's webinar is an hour long. It may go a little bit past the hour. We try not to, but if it does, don't worry if you have to leave. You'll still get your CE certificate. And of course, because we're going to have lots of discussion, you can certainly, or Renee will be leading a very interesting discussion, you can certainly ask questions. So feel free to ask questions at any point in time using the question box on your GoToWebinar dashboard. I will be answering questions, and if there's something that I can't answer, I will leave it for Dr. Schmid to answer at the end. So very quickly, let's get started. I'm going to just tell you a little bit about Pet Poison Helpline for those of you who aren't familiar. So we are a 24/7, 365 days a year animal poison control center. We're based out of Minneapolis, Minnesota, and some of us are affiliated with the vet school here, being joint faculty on staff, and we're also affiliated with the College of Pharmacy at the University of Minnesota. So we have quite a few vets. We're one of the largest practices in the state. We have over 20 vets and over 50 CVTs. You can see some of our vets are board certified, and you can see the credentials listed there. And we're very unique in the fact that we actually operate a human and an animal poison control center side by side. So we also have several PharmDs, or doctors of pharmacy, on staff as well. And sometimes we'll use those as it's a very team approach here. We might consult with our PharmDs, especially when we get new human drugs that we're called about, and there's just very limited data out there. So our case fee is $59. We did undergo a price increase this spring, so that fee looks a little bit different too. That's why. Same services. The consultation fee includes unlimited callbacks about that same case, and then at the end of those cases, we will go ahead and fax or email the clinic a copy of that case report, and we actually can do that in an ongoing pattern as well. So the other thing that I think really is unique about Pet Poison Helpline, and one thing that we really pride ourselves on, is being an educational center. It's one of our missions. I think that we do it very well. We really want to help other veterinarians out there who we really see as our partners understand toxicology. So we do things like present webinars. We give a lot of lectures at conferences. We'll be at AVMA coming up this summer. We have a couple of tools like the Wheel of Vomit, which many of you have seen. We have a couple of textbooks that are out, iPhone apps, etc., and certainly a lot of free resources for your clinic. And this is important because I think these are really helpful. Free 1-minute videos that you can put on your social media sites, on your clinic, other electronic materials, seasonally appropriate things like, for example, spring toxins that you can put on your, again, share on social media and put on your clinic site. So you can find some of those on our website. Otherwise, feel free to just email us and we'll get stuff sent over to you. So at this point, I would like to turn things over to Dr. Carol McConnell from Nationwide so she can say a quick bit about Whole Pet, and then we'll proceed. Dr. McConnell.
Dr. Britlock, thank you so much for having us, and I always enjoy working with you guys. It is such a pleasure. The degree of professionalism and the number of resources that you have available that you give back to the profession, as exemplified by that list of educational items, is most impressive. We are delighted to sponsor you guys and have been doing this for about 8 years now. So just very quickly, because time is of the essence here, we got to get to the guts of the fun stuff. Just want to tell you guys a little bit about our new product called Whole Pet with Wellness. And this is one of these type of pet insurance products that is what's called an open percentage of invoice, meaning we reimburse 90% of virtually everything you do in that exam room or surgical suite or what have you. Our goal is to not only cover when the pet is sick, but also when the pet is well. And this is a result of a lot of market research that we've done with pet owners. Their expectation is that their pet insurance policy should behave like their human policy, like when they take their kids in to the pediatrician, why isn't the wellness visit covered? Why aren't the vaccines covered? So we have brought to market Whole Pet that covers absolutely everything, truly blankets the whole pet. So next slide, I'll tell you a little bit about what's in there, and you guys can read faster than I can talk, so there you go. Probably the most important variable is an annual deductible, meaning once satisfied once per year, $250 annual deductible, they're done, 90% thereafter. And so obviously rechecks or just a different incident down the line in that same policy year. Now pay attention to other pet insurance policies. Many of them may say they have a $250 deductible, but it won't be annual. It may be per incident or per condition. And you guys obviously can do the math. That behaves very, very differently. Again, it's all-inclusive wellness, and when the pet is sick, and all the way up through emergency and specialty as well. And so you guys can read that list. Probably the one that is most noteworthy is the hereditary conditions are indeed covered, and that was something in the past that was adding a degree of confusion in the world of pet insurance. And so Nationwide, with a household name and brand reputation to protect, wanted to make sure that we covered something broadly and got rid of all of the confusion that is in the past been related to pet insurance. So then next slide. It's actually easier to tell you what's not covered. The non-veterinary fees such as tax and waste, boarding and grooming, I think that's all pretty self-evident to those of us who are clinicians. The one that probably needs just a minute here to point out is the pre-existing conditions. And so any pet insurance policy cannot cover pre-existing conditions. Quite simply, insurance exists as a risk pool, and people pay in their premiums, and those who do have a loss of an unanticipated event, something you didn't see coming, can submit their claim and get reimbursed from that risk pool of money. If we did cover pre-existing conditions, people would just wait until the pet was sick, then apply for the insurance, and the risk pool would be dwindled very, very quickly, paying for sick animals, because effectively the cost of those sick pets was being deferred over to the insurance company. So it's just not a financially sustainable model. As much as we'd love to be able to help cover pre-existing conditions, we just can't. It doesn't work mathematically. So next slide, and I think I'm in the home stretch here, is our goal is the same as yours, which is to keep the pets happy and healthy. And be sure that any pet insurance that you recommend does indeed cover the whole pet, which includes both the preventive care and all of your examinations. So with that, I will turn it back over to Dr. Brutlog, and she can take us from there. Thank you.
Excellent. Thank you so much, Dr. McConnell. So at this point, it is my great pleasure to introduce Dr. Renee Schmid. She has been with Pet Poison Helpline since 2013. Not only is she an excellent veterinarian, but she's an excellent person, a good friend of mine. She received her BS in agriculture and her DVM, both degrees from K-State, Kansas State University, as she will happily talk for hours about. If there are any other K-Staters out there, I think this is a K-State phenomenon. But since veterinary school, Dr. Schmid has worked in a variety of small animal practices as a general practitioner, and she also received additional clinical training through an anesthesia residency, also, no surprise, through K-State. So without further ado, I'm going to turn things over to Dr. Schmid and let it go from there. Thank you. Renee, it's all yours.
All right. Thank you, Dr. Brutlog. Well, welcome, everyone. I really appreciate you guys taking the time today to spend an hour with us to learn a little bit more about decontamination methods for the patients that you have. We're going to jump right on into it today. Our goals are going to be to review the different methods of decontamination. We're going to discuss the pros and cons of each method of decontamination. We're also going to discuss how to choose the ideal method. It's based on the toxin, based on the animal, based on the timing. There's a lot of different things that go into us deciding what we should best do for that particular patient. There's four main types of decontamination: ocular, dermal, inhalation, and gastrointestinal. And while gastrointestinal certainly probably encompasses the most common types of decontamination that we have to go about, we want to make sure that we're taking care of the ocular, dermal, and any respiratory issues as well. We're going to start today talking about ocular decontamination with indications for irritants or corrosive chemical exposures, those animals that have been sprayed with mace, or perhaps they've gotten into a bottle of a household cleaner and that has splattered up into their eyes. Things that we need to look at for that to really make sure we're protecting that eye or treating any potential issues. It's important that we know what the pH of that is. Is it acidic or alkaline, or is it a neutral pH? Looking at keywords on the bottle. Caution will kind of lead us to the side of irritants, whereas danger is something that tells us we need to be a lot more concerned and probably treating a lot more aggressively, as they can have some corrosive damage. A good rule of thumb is that if it's something that's going to cause burns to the skin, it's going to damage the eye. Performing the decontamination for the eyes as quickly as possible is really important to try and minimize the amount of corneal damage that occurs. A lot of times we like to have the owner start this at home so they can start doing some decontamination and irrigation before even making it into your clinic. Some of the best flushes to use, if there's a labeled eye wash, that certainly would be the most ideal. Tap water does come in a good second for that. LRS or saline can be used in certain situations. We always want to avoid eye drops such as Visine or redness reducers. Those aren't really going to do much as far as the decontamination and irrigation goes. There was a study that was published back in 2008 using rabbits that had alkali eye burns, and they looked at the difference between using just plain tap water and isotonic saline for irrigation. And they found that actually isotonic saline was not as effective at tap water. And so generally speaking, if someone doesn't have a labeled eye wash to use, then tap water would be the next best thing. And then as far as separating out whether or not these are irritants or corrosives, a lot of times on irritant products, the owners can perform the irrigation at home. We like to try and irrigate these eyes for about 10 to 15 minutes. And while that certainly sounds like a long time, particularly if you're the pet owner that's trying to hold the animal down to get that done, certainly giving them some breaks in between to minimize the stress on the animal. I don't know about you, but I always kind of add a couple of minutes onto my time recommendations when I'm instructing an owner to do something, knowing that it's unlikely they're probably going to go to that full extent. And so my hope is that maybe we can get 8 to 10 minutes out of them if we give that recommendation for 10 to 15, although the 10 to 15 would certainly be most ideal. The owners can monitor at home for any signs of irritation, pawing or rubbing at the eye, any redness, lacrimation, squinting, or swelling that might occur. And then certainly if any of those signs develop, then they need to bring that pet into you to be evaluated. Things are handled a little bit differently when we're dealing with corrosive products. We certainly want the owner to attempt irrigation at home for 15 to 20 minutes. So we want to increase that time frame. Again, trying to get out as much of that product or as much of that contaminant as possible. And then they need to make a trip in to see you guys. And you'll want to continue to irrigate that eye for another 15 to 20 minutes with an eye wash or tap water if that's not available. It's important to do a fluorescein stain with these just to make sure we know where we're at with getting started as far as the treatment goes. Even if the cornea looks normal, the fluorescein stain is negative, we're going to send these guys home on a topical antibiotic ointment or drops, certainly wanting to avoid anything that contains a steroid, as the change in the health status of that cornea and eye can change over the next 1 or 2 days. An e-collar really is very important in these cases just to help prevent some self-trauma. These animals a lot of times will have some significant itching or burning, irritation to the eye, and they'll really want to rub at it, which then will just cause more damage. The owners then need for signs to develop at home if they are asymptomatic at the time of presentation, or certainly any worsening of the signs as the time goes on. Moving on to dermal decontamination methods, there are several different reasons why we need to remember the skin, we need to remember the hair coat when an animal has been exposed to something. And a lot of those will be with corrosives or irritants, some systemically absorbed toxins that may not actually cause dermal irritation or dermal toxicity, but can actually be very problematic when they're absorbed systemically. Tea tree oil is a good example of that. Any glues or adhesives that can cause some irritation to the skin. If we're wanting to prevent oral exposure by self-grooming, again, with tea tree oil, if we want them to not be looking at that area and getting that oral exposure. Also, if we need to remove some unwanted substances or anything that may be on the skin that could cause some irritation. Paresthesia is a big one. We're getting into the middle of flea and tick season here, and it's not uncommon to have topical flea and tick products cause some tingling sensation or that paresthesia response in the area of application. And a lot of times we need to do some decontamination to provide relief to that animal. And then burns are another instance when we have to look at decontaminating that skin and hair coat. It's important to use personal protective equipment when we're dealing with dermal decontamination, particularly for the corrosive products. Wearing gloves, glasses or goggles, a gown or long sleeves, really important. Obviously, if they're going to cause specific irritations or issues with the skin and the animal, we want to protect the staff or whoever it is that's helping decontaminate that animal so that they don't have any issues themselves. When we look at between irritants and corrosives, and we talked about it a little bit on the ocular side already, but we want to look with irritants that have that caution signal word. So the caution tells us, oh, we need to perk our ears a little bit, but we don't need to get too concerned with a high aggressive care. A lot of times these will cause mild redness or irritation to the skin. Typically rinsing them in water or bathing them with a liquid dishwashing detergent is all that needs to be done. Topical vitamin E is something that may or may not be beneficial. Obviously, if the animal has generalized irritation from an irritant product, it's a little bit difficult to get vitamin E all over that animal. But I think that vitamin E can be somewhat beneficial in those paresthesia responses where they have a localized area where they're having some irritation. When we look at corrosive products, and this picture of Drano is a great example of a corrosive product, that danger is the signal word. These drain cleaners are very corrosive and things that are very common to see in the household that animals can get into. We want to look at corrosive products consider corrosive products that have an alkaline pH greater than 11.5 or an acid pH less than 2 to 3. In these animals, it's important to rinse them off really well for 15 minutes with even just regular water, and then bathe them with a liquid dishwashing detergent, something that has a degreaser in them to help get that off. I will often bathe the animal rinse, have them bathe again. Sometimes we'll have the owner start that at home, get at least a good rinsing in, maybe one bath in. They go to the clinic to see you guys, and then we repeat that process. And then obviously with corrosives, we often have burns developing, and so burn care would be necessary. For systemically or orally absorbed toxins, such as tea tree oil, topical pain creams, estrogen creams, permethrin and pyrethrin issues in cats, psoriasis cream, and 5-FU, a topical chemotherapeutic agent in humans. These are things that we may not necessarily see dermal issues, but they can become, they're highly toxic if they're absorbed systemically or if the animal is able to turn around and ingest any of that product. So these are really important that we bathe them 2 to 3 times with a degreasing dish soap. Some cases activated charcoal may be indicated. Also kind of depends on the timing of the application. Blood work and supportive care can also depend on the toxin type. When we look at glues and adhesives, fortunately, typically these tend to be non-toxic, not have a big concern with dogs and cats. They can, however, adhere to the eyelids, to the teeth, the skin and fur. So it really depends on how aggressive we're going to be based on where that glue or adhesive is. You can loosen that up a little bit with an oil or a vegetable oil. You can certainly bathe the animal. Sometimes that will be helpful. You can also clip the fur in the area. And then sometimes you just may want to do nothing. If it's not in an area that's going to cause a lot of concern or be problematic, then time will just allow this to fade away with time. When we look at gasoline and hydrocarbons, if an animal had a great exposure to just regular gasoline or any other type of hydrocarbon, we can see defatting of the dermis, which is quite painful to these animals. And analgesics are certainly an important aspect for them. There's also a risk of aspiration depending on how much of that liquid that they were exposed to. Inhalation of the fumes certainly can cause some CNS depression. These guys, it's important that we bathe them several times with a degreasing dish soap to minimize those secondary effects as far as licking and ingesting it for aspiration and any inhalation of those fumes, and then hopefully minimizing their risk of that defatting dermis and that dermal pain. When we deal with burns really with the treatment kind of depends on the degree and the body surface area that's affected. If it's been within 2 hours, regardless of the type of burn or the cause of the burn, we like to rinse these with cool water for about 30 minutes. And that really can help minimize some of the effects of the damage that these products or that the cause of the burn can result in. With first-degree burns, typically lavaging with cool water and providing topical therapy is sufficient for treatment. Second or third-degree burns, we do have to get a little bit more aggressive. They often require debridement, treatment with silver sulfadiazine, analgesics, as they're typically very painful. We also want to monitor for metabolic derangements such as sepsis, which is something that we can certainly see more frequently with third-degree burns. Moving on to inhalation decontamination. Inhalation is something that we can certainly have issues with when an animal's been exposed to a concentrate or a corrosive. Again, the fumes can be very irritating to the respiratory tract. Smoke inhalation, gas exposure to chlorine, carbon monoxide, natural gases can have a lot of respiratory issues and potential damage developing. The best thing to do and the first thing to do obviously is to remove that animal from the source of the vapors or the gas that they're inhaling. For minor irritants, generally fresh air is all that they need and they can do very well. When we talk about concentrates or corrosives, they often require much more aggressive care such as oxygen cages, more oxygen support, potentially nebulization. When we think about bleaches and ammonia mixtures, it's not uncommon to have people mix those together because since one is good, both of them together is better. But unfortunately, they form a chloramine gas, and that can be very irritating to the respiratory tract and potentially fatal in some cases. For smoke inhalation, we need to be concerned about carbon monoxide with its causing decreased oxygen carrying capacity. Toxic chemicals really are variable as to the degree of respiratory irritation and damage that can be done. Thermal injuries, we can see edema, erosions, and ulceration to the mouth, to the respiratory tract. Hydrogen cyanide can cause cyanide toxicity. And any animal with underlying respiratory disease certainly may require more intensive treatment. I make one mention of birds throughout this talk, and it's really just to make a quick mention based on some of the inhalation issues with birds. Birds are extremely sensitive to having any type of gas, fumes, vapors, even just fragrances in the house, using a house spray, Teflon, respiratory irritants can really be problematic for these guys. They generally need to be treated fairly aggressively, obviously, again, removing them from their source of contact, putting them in a humidified oxygen cage, offering heat support as their method of heat exchange is going to be altered with respiratory issues, and then providing fluids as needed. All right, so getting into the gastrointestinal decontamination methods, as I mentioned, this is obviously the biggest one, kind of the nuts and bolts of what is done on a more frequent basis. There are 6 different main types of decontamination in the GI. emesis, gastric lavage, activated charcoal, cathartics, whole bowel irrigation, and then endoscopy and surgical removal. We're going to touch on each one of these a little bit. We're going to talk about what the pros and cons of each are, when we should pick them, when we should not, and we'll go through each of them now. So the first one with emesis, probably the most common decontamination method that we use in small animals, certainly the most common we'd likely use when we're talking about GI decontamination. It's something that often can be done at home by the owner. It's something that most clinics have the ability to get done. Doesn't require a lot of extra equipment or costs, and so again, it can be very effective. So indications for this, the animal really should be asymptomatic. When we look at an animal who has had a toxicity that has neurologic abnormalities or that affects the neurologic system, we certainly don't want to induce vomiting on an animal that can't protect its airway and could potentially risk aspiration. There's foods, many of the foods that we can use that the animals get into that we can use emesis for, such as grapes and raisins and gum, medications, typically for any type of a tablet or capsule forms, we can get good emesis returns from them. Large ingestions, maybe they're not actually a toxic ingestion. Maybe this dog ingested a pound of peanuts, and we certainly don't want to see the risk of pancreatitis or just significant gastroenteritis developing, and so emesis can be a really good indication for that. Rodenticides, we certainly want to be careful with some of the rodenticides with inducing vomiting. Zinc phosphide in gopher baits is one of them that it does produce a phosphine gas that can be toxic to humans as well. And so we want to use caution when we're recommending emesis with certain rodenticides, but certainly something that can be done. Small or dull foreign objects, so if this little guy ingested a small or maybe a small round piece of plastic, something that isn't really sharp, then this would certainly be an area to induce vomiting for. We want to make sure they don't have a breed or a health risk. Brachycephalic dogs, not that you can't induce vomiting with them, but we want to be a little bit more careful with that as they may have some issues. A dog who's in congestive heart failure may not be the most ideal patient to induce emesis with. Some contraindications, as we kind of touched on it a little bit, symptomatic. Again, neurologic status is really key in these guys. We want to make sure that they can not only swallow well, but they can kind of sit up. One of the worst things we can do is to try and vomit a dog who's lateral recumbent or fairly lethargic and sedated, and then potentially have that risk of aspiration developing. If that animal's already vomited to bile or vomited to empty, there usually isn't going to be much benefit to inducing vomiting at home. Maybe they vomited several times at home, maybe they vomited several times on the way to the clinic, and so inducing vomiting with them again in the clinic isn't likely to be beneficial. If they have a history or risk of aspiration pneumonia, animals who have a laryngeal paralysis, a negative esophagus, certainly would not be a good candidate for inducing vomiting. And we'd have to look for other methods of decontamination to help with their toxin exposure. Any sharp or dangerous objects, obviously, if they have a sharp tip, glass, a lot of those things, we just don't want it to come back out through the esophagus. We can certainly have, the esophagus isn't a very forgiving structure when it comes to damage at times, and so we want to try and preserve that as much as we can. Corrosive agents, again, we don't like to induce vomiting for these guys. Punctured batteries, disc batteries, we're going to talk about this in the surgical removal portion of it, but minimizing that potential exposure again to the esophagus. We don't want alkaline substances or acidic substances coming back up, as there can be a lot more damage developing. Hydrocarbons such as gasoline, kerosene, and motor oil, really they have a good risk or a high risk of aspiration developing. Motor oil certainly carries a lower risk than gasoline or kerosene may due to its viscosity and lower volatility, but still things that generally would be better off to just let pass through the GI tract. Some other contraindications would be species that we like to avoid inducing vomiting with. One, either they don't vomit or they shouldn't vomit. Rabbits, ruminants such as sheep, cattle, llamas, and goats, horses, birds, rodents such as chinchillas, rats, and gerbils. Really not species that we're going to try to do any type of emesis with. When we talk about emesis in the dog and cat, we want to really know how much are we going to get out? What's the bang for our buck here, and why should we induce vomiting? And we look at the gastric content recovery. And I generally tell people that on a good day, a dog is going to get about 50, maybe 65% of their stomach contents out when we induce vomiting. So the average is 49. The range really is pretty broad. It can be anywhere from 9 to 75%. And that's with emesis that occurs less than 30 minutes after ingestion. When we get to start inducing vomiting in an animal where it's been an hour or so after ingestion, then our range is not quite as broad, but still 17 to 62%. Usually, we like to recommend vomiting in these animals most commonly within 2 hours after ingestion. There are certainly exceptions to the rule, and some of that we can see have some safe vomiting up to 6 hours after ingestion. We look at grapes and raisins, it takes quite a while for those to really break down in the stomach. And so while they may not be 100% intact 6 hours afterwards, we can still get a really good content back. Chocolate is poorly absorbed, or I should say slowly absorbed, and so we can still have some really good results as far as emesis goes up to 6 hours after the ingestion. And a lot of times these guys are ingesting a large amount of chocolate, so it's going to take a while to get all of that broken down and absorbed and passed through. Xylitol gum, while xylitol itself is rapidly absorbed, it is something that is infused throughout the gum. There is a good coating of xylitol on the outside, provides that nice, powerful punch of a tingling sensation and flavor, but then it's also infused throughout the gum. And so if we have an asymptomatic animal and they still have not vomited yet, we can get some of this gum out to minimize the continued absorption of xylitol, then it's certainly valid to do that again up to 6 hours out. We talked a little bit about bezoars. Bezoars aren't very common, and these are some things that we can actually see potentially, theoretically, we can see issues with large ingestions of certain medications, and they can clump together in the stomach and form a bezoar, kind of a glob, so to speak. And that's something that really is going to take quite a while. It's going to be in the stomach for a bit, and so it's something that you could consider inducing vomiting for up to 6 hours out. Massive ingestions, which Labrador didn't eat the 200 tablets or the 200 chew container of glucosamine tablets, or the urine saver, the grass saver urine tablets. And so those certainly, it's going to take quite a while to get those broken down, and they can certainly have vomiting induced quite a ways out. There are drugs that work in our favor when it comes to inducing vomiting by decreasing their gastric emptying. So buys us a little bit of time with opioids, salicylates, anticholinergics, and tricyclic depressants. We can push the limit just a little bit as far as inducing vomiting with them further out than we could with another medication. There's two main types of vomiting or medications that we recommend for vomiting in dogs: apomorphine and hydrogen peroxide. Apomorphine is a dopaminergic drug. It's not an opioid as the name would suggest it to be. It stimulates dopamine 2 receptors in the chemoreceptor trigger zone. A standard dose would be around 0.03 milligrams per kilogram IV and 0.04 milligrams per kilogram IM. If you're using tablet formula, you can certainly just crush that tablet for conjunctival administration. Give half a tablet for a small dog, 1 tablet for a large dog. It's important to really rinse out that eye after that is done, just to help prevent any ocular irritation and any continued vomiting. With hydrogen peroxide, it's something that the animal owners can easily use at home. We want it to be a 3% grade that you can just buy off the shelf at your local grocery store or pharmacy. It should be fresh, bubbly, and non-expired. Even if it isn't expired, we want to still make sure that it's bubbly. If it doesn't have that little bubbliness to it once you pour it out, then it's likely not going to be very effective. It is a gastric irritant, so we do have a limit as to how much hydrogen peroxide you want to use in a dog. We typically recommend 1 to 2 mils per kilogram, which equals out to be about 1/2 to 1 teaspoon per 5 pounds, something that again can easily be dosed by the owners. I wanted to point out this particular paper that was published in 2016 in JVEX, and it studied the effects of oral 3% hydrogen peroxide that used as an emetic on the gastroduodenal mucosa of healthy dogs. Now, while this study wasn't large in number, I think that it's a very important one and drives home the fact that we need to remember that vomiting is not a benign process. Using hydrogen peroxide particularly is not a benign process. We don't want to just tell the owner to keep giving hydrogen peroxide until the dog vomits. And we want to make sure that there's a reason for inducing vomiting and that there's truly a benefit to having them vomit. This particular study had 7 healthy dogs. They were clinic-owned pets. And before the study started, they had no endoscopic evidence of gastritis. 1 dog was the lucky dog and was assigned as the control and just given apomorphine to induce vomiting. They used a new, previously unopened bottle of hydrogen peroxide in these guys. They gave 2 mils per kilogram administered orally with a maximum limit of 45 mils. They took gastric biopsies, again, before the hydrogen peroxide was given, at 4 and 24 hours, and then again 1 and 2 weeks post-administration. Now, there was visual gastric mucosal lesions visible at 4 hours in all dogs, including the dog that received apomorphine, and it slightly worsened by 24 hours. And then the most interesting portion that they were looking at was the duodenal mucosal lesions. They found mild to moderate duodenal mucosal lesions within 24 hours in all dogs that were given hydrogen peroxide, not the apomorphine dog. And then with histopathology, they found severe gastric lesions being as severe as hemorrhage 4 hours after the hydrogen peroxide was given. And at 24 hours, they found degeneration, necrosis, and mucosal edema. 1 week out, they found inflammation. And 2 weeks out, they found that most of the visual and histopathologic lesions were resolved. So again, this kind of drives home to us to say, this isn't benign. This isn't something that we should just say, oh, let's just go ahead and vomit the dog, and it's not going to be problematic. Moving on to emesis in cats. Cats are always the tricky ones because they will vomit wherever and whenever unless we want them to. And then it becomes much more difficult to get them to vomit. The 2 main recommendations or 2 main medications that typically are the most effective are going to be xylazine and dexmedetomidine. They're both alpha-2 adrenergic agonists. The dosing for xylazine is typically 0.44 milligrams per kilogram IM, and for dexmedetomidine 5 to 10 micrograms per kilogram IM. It's nice that we have reversals for that, so yohimbine for xylazine, antecedent for dexmedetomidine. There's some cons to both of them. The efficacy, which we're going to talk a little bit more about in these next few slides, can potentially be as low as 50%. We can see some excessive sedation. We can also see cardiovascular collapse. We're giving an alpha-2 adrenergic agonist. Probably the 16-year-old kidney failure cat or hyperthyroid cat probably is not going to be quite the candidate to have this given for emesis. There's two studies that we're going to look at. One of them is dexmedetomidine versus xylazine. This was published in JAVMA, and this study was published in 2015, and it reviewed dexmedetomidine, hydrogen peroxide, as well as xylazine. The other study we're going to look at is one that was published in the AHA journal in 2015 as well, and it compared xylazine and dexmedetomidine for effectiveness for emesis in cats. Now, between those two studies, there were 43 cats in the AHA publication, and there were 47 cats in the JAVMA publication. The AHA publication, they gave 3 cats hydrogen peroxide. None of them had vomiting induced. In xylazine was given to 25 of those cats. One of the cats that's in that xylazine group had also been given hydrogen peroxide, so he has a double whammy. They had 11 of those cats induced vomiting, so 44% success rate. In dexmedetomidine, they used 16 cats and they had an 81% success rate, so pretty high success rate for cats. With the JAVMA one, they had 47 cats in the study. 21 of those cats received xylazine with only 43% inducing vomiting, so pretty much the same with the other study that was done. And then 26 cats were given dexmedetomidine, and 15 of them had vomiting induced, so 58%. So still pretty good return for cats all in all. The main side effects for all of these was sedation, but again, we had that nice reversal that we can reverse that. Methods that we don't want to use for cats: hydrogen peroxide. It's just not very effective. It has a much higher risk of having hemorrhagic gastritis occur. Fatalities have been reported with large amounts of hydrogen peroxide use in cats, so it's really just best avoided. Apomorphine, typically it's not effective either. We can see some overstimulation of the CNS, but in cats we find that most of that chemoreceptor trigger zone is going to be stimulated by alpha-2 agonists versus dopaminergic receptors, so we're not going to see much effect with apomorphine. Some inappropriate methods for decontamination, for vomiting: salt. We get a lot of calls where the owners gave salt to the animal. Salt, we have a big concern with developing hypernatremia. As low as half a teaspoon per kilogram can cause toxicity to occur, and so something that's best to be avoided, particularly if they don't vomit. If they don't vomit and the owner gave several cups of salt, then what? And we have a much higher risk of having toxicity. Syrup of ipecac, we can see some cardiac effects and prolonged vomiting. Digital stimulation, a lot of people try to stick that finger down the throat, get the dog to vomit. We can certainly see some physical injury and potentially some nerve damage developing. Liquid dish soap is typically ineffective. We could potentially have some aspiration risks. Raw eggs, Tabasco, mustard, any other creative technique that owner is thinking of usually are not going to be very effective. Moving on to gastric lavage. Gastric lavage is something that certainly is a valid method of decontamination. It isn't used very frequently because it's somewhat labor intensive, and sometimes it's not going to be very beneficial, but it is something to certainly consider. Some indications for using gastric lavage would be in species that don't vomit, or if you've had unsuccessful emesis attempts. If there's a large volume of stomach content, that can be very helpful. Also, in some symptomatic patients with a large ingestion, it really varies based on the toxin as to what that reward would be. When we're looking at moldy foods with mycotoxins, we might have some good luck getting some of that back. Any potentially life-threatening toxin that really gastric lavage is going to be the next step because emesis isn't indicated would be something that we could use gastric lavage for. Some contraindications: hydrocarbon ingestions. Again, we really want these hydrocarbons to just kind of pass through. Although we're using a stomach tube and we're getting a large amount of this out, when we think about the esophageal sphincter, we're most likely going to have some of those gastric contents come back through and come up through the gastroesophageal sphincter and around the stomach tube, and so best to avoid that. Corrosives for the same reason. Recent surgery, predominantly any type of GI surgery, we really don't want to gastric lavage these guys. Any patient that has a higher risk for bleeding or injury or the appropriate time frame, if we're 10 to 12 hours out, we're not likely going to have much left in the stomach, and so likely not going to have benefit with gastric lavage. Liquid toxins, there's really a fairly limited benefit to that. So the method of gastric lavage, we're going to sedate them. They need to be intubated. They need to have an endotracheal insufflation. It's very critical that we've protected their airway to minimize any potential risk of aspiration. They should be lateral recumbent with the head tilted down at an approximately 20-degree angle. You're going to measure that tube to the last rib, flush with 5 to 10 mils per kilogram of warm water through a nice large bore stomach tube. You want to agitate that stomach, really swish it around, and then either aspirate or just allow gravity drainage of those stomach contents. I put plus or minus activated charcoal on here because I think that there's certainly some potential concerns with giving activated charcoal after gastric lavage. You definitely want to give an antiemetic first because after they wake up and come around, we don't want them vomiting that activated charcoal. We want to keep their head elevated, and you want to keep them intubated until they're able to protect the airway. I kind of think of them as the bulldog that's just waking up from surgery, where you really don't want to extubate them until they're about to walk out the door. And I like to do that to keep them intubated as long as possible with these guys if you're going to give activated charcoal, because in certain situations, and particularly ones where we may say like a baclofen case where that animal is comatose and extremely obtunded, sometimes they may regurgitate that activated charcoal and they won't be stable enough, they won't be neurologically appropriate enough to protect that airway. And then we've created another potential issue, a potentially life-threatening issue on top of the toxin that we're already trying to treat. Here's some pictures of gastric lavage. So they're measuring, Dr. Peterson is measuring the tube to the last rib, intubating that animal, making sure that that cuff is nice and inflated, passing that stomach tube, pouring down that nice warm water at 5 to 10 mils per kilogram. Then they're going to agitate that stomach and then drop the stomach tube down, and then you get the results there with the contents of from the GI. Moving on to activated charcoal. Activated charcoal has been called the most important universal antidote in the treatment of intoxication by chemical agents. And activated charcoal is a carbon residue. It's derived from vegetable material. It's produced by exposing the original material to an oxidizing gas compound of steam, oxygen, and acids at high temperatures. That oxidizing gas, it makes a nice creation of networking of fine pores that results in the charcoal, and that turns into an enormous surface area for activated charcoal to allow for adsorption of the toxin. And the capacity of that activated charcoal is a function of its binding surface area. And in commercial products, that surface area varies anywhere from 1,000 to 2,000 meters squared per gram. So a really large surface area. The adsorption of substances onto the charcoal, we have to remember that it's a reversible process. So once it adsorbs or once it kind of binds to the charcoal, it's not an all and done process. It's something that with time will actually break apart, or those weak covalent forces will loosen, and then that toxin can start to desorb as well. So some of the benefits of giving activated charcoal: it's readily available, it's relatively inexpensive, it's suspected to bind to most toxicants, although there's a lot we still don't know as far as what it does bind to. Even with delayed administration by numerous hours out, we may still get a decrease in absorption by about 25 to 30%. So in large toxicities, 25 to 30% might still be beneficial to us. You can certainly administer it with food to encourage ingestion. The risks are that sometimes we don't know the benefit. Again, we know a lot of them we know a lot about the medications that it does bind to, but there's still a lot that we don't know. There's thousands of different medications out there. Activated charcoal has not been tested on every one of them to know if it's going to be beneficial or not. Is there a 2-hour window for administration? Ideally, we like to get it done as soon as possible to minimize that absorption. However, again, as I mentioned in the benefits, you may still have a decreased absorption of the drug or the toxicant by 25 to 30%, even if it's delayed a little bit. We do run that risk of hypernatremia when we give activated charcoal. Activated charcoal, we're going to see a fluid shift, an increased fluid amount into the GI tract, which can cause hypernatremia to occur. So it's really important that we keep an eye on the sodium levels, especially if we're going to give multiple doses. It can be difficult to administer. It's often messy. They can have vomiting after administration. I always like to preemptively give an antiemetic before administering activated charcoal. Wait 10 or 15 minutes after the antiemetic to try and hope to minimize that risk of vomiting from occurring. Diarrhea and changes to the stool can occur, something that's important to make sure the owners know so they don't panic when they get sent home and the animal starts to have some black tarry stool come out with diarrhea from the activated charcoal. And then it can bind to therapeutic medications as well. So we have to be careful about other oral medications that are being used. Some things that are not known to significantly adsorb a number of substances for activated charcoal. We know there are some things that just aren't going to work. There's a big list here. The ones I would just kind of point out, obviously heavy metals, any corrosive and caustic chemicals, we're not going to really see absorption from that. Petroleum distillates, some ethylene glycol, metaldehyde, some of those rodenticide baits, camphor and xylitol. Now, while xylitol does have some binding of activated charcoal, it's only about 16 to 22%. And so the benefit to that, to giving it, probably is pretty low. 16 to 20% isn't probably going to give us much bang for our buck. The binding of activated charcoal, as I mentioned, it hasn't been tested against all of the drugs or the chemicals, so there's still a lot we don't know. Some contraindications to giving activated charcoal. We certainly don't want to give it in a neurologically inappropriate animal. If they can't protect their airway, if they are bouncing off the walls with agitation and hyperactivity, and we can't safely give it and would have an increase in aspiration, then it's something that should be avoided. If the animal is dehydrated, hypernatremic, or has hypovolemic shock, certainly we're not going to help anything and make things worse most likely if we're giving activated charcoal as well. If they have a decreased GI motility and ileus, we don't want activated charcoal sitting on the gut. Again, it's not a permanent process. And so while that adsorbs and binds and attaches to those toxicants, it can also desorb and unbind. And so we don't want to have activated charcoal just sitting on the gut. If they've had recent surgery, if they're having protracted vomiting, if the time frame is inappropriate. Extended release formulas, we still might be able to have some luck if we're 8 hours out or so. But in most cases, if it's been a really prolonged time, we're talking 10 hours past or something like that, then most of the time activated charcoal isn't going to be helpful unless it's something that undergoes enterohepatic recirculation. Some other contraindications include ingestion of a caustic substance or hydrocarbons. We're going to have that risk of aspiration pneumonia, and we're not going to really have benefit from that anyways. Endoscopy, if you have the thought that you may be needing to do endoscopy on this animal, it certainly don't want to have to try to muddle the way through activated charcoal when you're not going to be able to see anything anyways. Abdominal surgery of the GI tract. If this is potentially an obstruction, something that may have to go into surgery, then you certainly don't want to have activated charcoal in your way. The risk for aspiration pneumonia. So again, an unprotected airway for one reason or another, if this animal is logically inappropriate, they have that decreased level of consciousness, they're obtunded, or if they have excessive sedation or agitation, or if you're really having to force feed them. Force feeding them could certainly increase their risk of aspiration. Standard dosing for activated charcoal is around 1 gram per kilogram. In plums, we hit about 1 to 5 grams per kilogram. If we're going to do multiple doses, we typically will repeat this 6 to 8 hours if it's extended release medication. If it's enterohepatic recirculation, we'll go for an additional, for a combined total of 24 hours. The manufacturer of most of the activated charcoal products suggests giving half the dose for subsequent doses. Doesn't really give a recommended dosing schedule. We find that if we can have these animals on IV fluids to minimize that risk of hypernatremia, I don't generally decrease the subsequent doses. Universal antidote gel contains a mixture of activated charcoal and clay. It only has about 1/3 of the administered amount as charcoal. Clay is a pretty poor adsorbent, and so in general it's not recommended due to increased volumes that are needed. So typically, in order to really be successful with the universal animal antidote, you really need to give 3 times the recommended labeled dose for effectiveness. We look at cathartics. We can't really talk about activated charcoal without cathartics. And cathartics are an osmotic. They draw water into the GI tract. They accelerate the speed of the drug transit through the GI tract. They decrease the time for toxin absorption from the GI tract, and then they decrease the time for desorption of the toxin from activated charcoal. So it really kind of helps speed things through the intestinal tract. Sorbitol, probably the most common cathartic that we use in veterinary medicine. It's a hexahydric sugar alcohol, so an osmotic cathartic. It's poorly absorbed from the GI tract. It's metabolized by the liver and slowly converted to fructose. The good news is that insulin is not necessary for the intracellular transport of sorbitol, so we don't have a concern as with hypoglycemia developing as we would with xylitol, even though this is a sugar alcohol. And with its hyperosmotic cathartic, we're going to see that increase in water in the large intestine. We're going to see an increase in intraluminal pressure, and that's going to stimulate catharsis. Sorbitol, fortunately, does not compromise the adsorptive capacity of activated charcoal, so it's very good to give together. It's the most rapid and potent cathartic that we have. It comes in a 70% solution. The dosing is 1 to 3 mils per kilogram orally. It's often already in activated charcoal preparations, so you're just going to dose the animal based on the activated charcoal amount, and the cathartic portion is already done for you. There are magnesium-based cathartics that can be used to a much less frequency. They typically increase the serum and brain magnesium levels. Magnesium hydroxide is one that we use fairly frequently in small animal medicine or small animal toxicities due to iron toxicity. Milk of magnesia, you give them 5 to 10 mils orally every 8 hours for only the first 24 hours. It's typically useful for some mild iron toxicity because it precipitates iron in the GI tract to an insoluble iron hydroxide and allows that to be passed through. Plus it increases the speed and the rate in which the iron is being passed. Some of the side effects are hypermagnesemia, which can cause hypotonia, ECG changes, and altered mental status, as well as respiratory failure. We want to use it cautiously in cats as they can be more sensitive. Generally, you'll see reports where it's not recommended for bromethalin toxicity. Really, the main reason is because it can exacerbate the signs or mimic toxicity signs, and then we don't know if they're symptomatic from bromethalin or because of the cathartic that was used. Whole bowel irrigation indications, again, something very uncommon for us to use, but certainly an important aspect for specific types of toxins and exposures. Enteric-coated drugs, iron, sustained or extended release drugs, and packets of drugs can certainly benefit from whole bowel irrigation. Using a nasoesophageal or nasogastric tube and polyethylene glycol at about 25 to 40 mils per kilogram orally. You're going to follow that with a continuous oral infusion of about 0.5 mils per kilogram per hour until you see radiographic clearance or clear effluent developing. Endoscopy and surgical removal. For endoscopy, it's great for coins, for non-leaking batteries, especially those button batteries. Again, those button batteries really like to sometimes get lodged in the esophagus, so it's really nice for us to be able to get those out with endoscopy. Patches such as fentanyl or lidocaine, if they weren't able to be vomited out, then endoscopy is a great way to get those out of the way. Bottles, plastic, other metals. You can certainly also evaluate for any type of injury or corrosive effects or caustic injury to the esophagus and stomach. For surgical removal, we're able to remove these endoscopically. Gorilla Glue, the picture on the right, is a result of a Gorilla Glue ingestion. It contains isocyanate, which has expansive properties. So an animal ingests this, it expands in the stomach, and it hardens and forms this nice large foreign body that can only be removed by surgery. Sharp objects, large foreign bodies, medication bezoars, leaking batteries, large numbers of objects that just aren't going to pass well, and then bread dough, definitely as it gets sitting in there, it can be really hard to pass and hard to come out in the vomiting. Sometimes we need to go in and surgically remove that. Some of the negatives can be that we see a delay in depending on the stability of the patient, the cost and the need for general anesthesia, the accessibility of the equipment. Obviously, operator skill is a factor when we're talking about endoscopy. So basically, in a nutshell, some of the things to think about when you're selecting the most appropriate method for decontamination. You certainly want to remember to consider the exposure type, the time frame since the exposure, the signalment of the patient, and the indications and contraindications of decontamination for that patient. And I'll send that back to Anna.
Excellent. Thank you, Dr. Schmid. Very, very well done. I really appreciate it. Thanks to everyone who asked questions. There are some really good ones out there. So if we miss some towards the end here, we will stick around a little bit longer and answer your questions. If you have to go because it's the top of the hour, that's okay. I understand. You will definitely still get your CE certificate. So just a couple of quick things that might be helpful for your clinic. We do have quarterly newsletters, and as I mentioned at the beginning, our video series, which is 6 short 1-minute videos that are really designed to pet owners about things like chocolate poisoning, lily poisoning, xylitol, etc. So those are available for free, and you can, again, put them on your clinic website or put them on your social media sites, and they've been very, very popular, so we're really excited about them. So, and of course, some other goodies that we have. If you don't have any of these or need some more, just feel free to shoot us an email. Not a problem at all, and we will get you hooked up. So a couple of people had asked about the textbook that we use. So, or I'm sorry, the textbook that we contributed to. This is it. This is the most recent edition, which just came out this year, 2016, bright pink, so you certainly can't miss it on the bookshelf. And it covers over 100 toxins in good detail, and it's really geared towards day practice vets and vets in an ER setting. So it's very clinical, geared towards people who, again, are in a clinical setting. So just as a quick reminder, this is only the second of our 2017 series. So we have 3 more toxicology-specific lectures, webinars, coming up throughout the remainder of the year that are sponsored by Nationwide. So please, we encourage you to attend these if you can. Again, if you miss them, they are always archived on our website, and you can go back, rewatch, watch other, have your colleagues watch them, etc., and receive RACE approval for watching those. So at this point, we're going to wrap things up. I want to thank everyone again for attending today. It's so encouraging to see these kind of numbers come in, and we love to see the questions and the comments that everyone sends in. So thank you so much. I'm going to leave this slide up just because, again, these are some of the frequently asked questions that we get that you may have been, that you may be wondering about. So I'll leave this up for a little while here, and Dr. Schmid and I will be available to answer questions through the question portal here, the question, I don't know what you call it, the questions on GoToMeeting or GoToWebinar. So again, feel free to ask questions. If there was something that you didn't get a chance to ask, you can always email us. Again, you see our email address there, info@petpoisonhelpline.com, and that will make its way to me or Renee and or the person that it needs to go to. So have a wonderful rest of your day, everyone. We look forward to seeing you again. Thank you.